Hi and welcome.
Thank you.
Please introduce yourself and your background.
Hi, I'm Dr. Stahl. I'm a professor of psychiatry at the University of California in San Diego and an honorary fellow at the University of Cambridge in the UK.
Today you moderated a very interesting session on non-communicable diseases and mental health. What were some of the key insights from this session?
Well, there probably were three. The relationship of sleep and of diet and of, if you will, putting on too much weight so you have inflammation and you're not exercising. So although those sound like general health issues, they actually are profoundly related to mental health issues in two ways. One is those three things can change your mental health, interestingly enough, and if your mental health is bad, it has a knock-on effect to your physical health. So it's not good to have, let's say, depression and a medical illness. It's just not good. Both outcomes are much worse.
What are the health and mental health challenges of our time?
Interestingly enough, the health and mental health challenges of our time are the combination of lifestyle with stress, plus the fact that you may get a mental illness from that, and that mental illness may have a knock-on effect of a physical illness. And the challenges are not just to see a psychiatrist from my perspective, that's what I do for a living, and to give medications, which is what I also do for a living. It's to try to encourage people to reduce their stress and their bad outcomes by things that are simply within our reach. What are those? It's diet and exercise. And so having a lifestyle that allows you not to be obese will prevent inflammation. A lot of that inflammation comes from too much fat, which actually brews a type of free radicals that causes aging. And so keeping obesity down prevents that. And exercise is amazing. It stimulates brain nerve growth and new connections, physical exercise, even more than mental exercise. So the idea of having your brain fresh and having your body in great shape reduces stress, which reduces the onset of mental illnesses, which then doesn't exaggerate and make worse physical illnesses.
What are the most promising preventative and treatment options for these health conditions?
The best thing is to not have a mental illness. Not the best thing is to treat the mental illness. So for so many of our mental illnesses, we are inheriting risk. We're not inheriting illness. And our lifestyle determines whether that risk turns into a mental illness or not. So the best things we can do is what's in our control. I don't know about you, but I can't change my grandmother. So I've got my genes and they're fixed and they're never going to change. But I can change what I do, and that would have to do with stress reduction. Now, those can be to do with making sure you get plenty of sleep, make sure that you have a balanced diet, you don't have obesity, and that you actually have physical exercise. Those things put together can mitigate the effects even of a group of bad genes you might have gotten from your inheritance. But if you buffer those with these lifestyle changes, then that'll reduce, if not eliminate, the onset of the mental illnesses.
What would you recommend to practicing clinicians?
My recommendation to practicing clinicians is to give this information out as a verbal prescription to all your patients, along with whatever advice or psychotherapy or medications. People will listen to you. A lot of us are self-conscious because a lot of us don't diet and exercise ourselves, so it's hard to preach about that. But get over that. It'd be good to try to take care of ourselves, of course, but I think people will still understand that you maybe reluctantly, if you don't do it yourself, they still will take your advice. So my advice is to actually become a champion for diet and exercise, along with the other interventions that we ordinarily give as psychiatrists.
Thanks as always.
My pleasure.